feel free to check it out later. By way of introduction, my name is Rasa. I'm a fourth year medical student at Loyola, and I events co-chair on the virtual PathSig organization. And today we're really happy to have a panel of amazing residents from 4 different institutions talk to us about the residency application process. And so with that, we'll kind of just jump into introductions. We'll go around, I see Cullen as the first person on my list, so I'll kind of like call him out. And then Cullen, if you just want to popcorn to your fellow panelists regarding the first question was just, again, introduction. So tell me, your name, your year, what program you're in, what medical school you went to, and then what drew you to pathology and any subspecialty interests that you have.
Okay, well, thank you for having me. First of all, my name is Cullen Lilley. I'm a third year at UCLA. I'm one of the chief residents here as well. Um, I went to medical school at Loyola, Chicago, so close to some of you over there. And then I'm applying right now to go into derm path, so we'll see what happens there. Fingers crossed. Um, And then what drew me to pathology? It's kind of like a long story, but I started in medical microbiology, and so I was working as a lab tech. I ended up getting a certification to become a molecular biologic technologist, and then worked at the CDC as a microbiologist, and then kind of saw what some of the infectious disease pathologists did, and I was like, that's really cool. I want to do that. And then when I got to medical school and I met the amazing pathologists, I was like, there's so much more you can do in pathology than I could even like imagine. So as much as I wanted to explore other things, I kept coming back to paths. So it's a great place to be. And I'll popcorn to Lauren because she's right next to me.
Hi, I'm Lauren. I am a current fourth year APCP resident out at the University of Michigan in Ann Arbor. I'm originally from Wisconsin, went to medical school at the Medical College of Wisconsin, and I am in transition between fellowships. I confirmed a cytopathology fellowship and about 4 months ago changed my mind and will be doing blood bank instead. I like to say I tripped into pathology back in high school. Kind of like Colin, I come from CP land. I'm a certified medical laboratory scientist, and as a senior in high school, a local university had a intro to lab medicine course that I was like, that sounds fun. Lo and behold, totally changed my entire career outlook, pivot to medical school, and hated everything else except pathology. And I was a blood banker during my master's program, which I did in the middle of my medical training. So I took a very circular, long route back to where I started.
I love it.
And Nisa, do you want to go?
Hi everyone, I'm Nisa Quintanilla Arteaga. I am a PGY1 at Northwestern. I went to Loyola Chicago for medical school. I originally got into pathology and medicine in general for forensics. I went into medical school with the intent of doing forensics. And as I went through med school, I realized that pathology was definitely for me. I hated everything else, or I couldn't see myself doing anything else. And then I realized that there are so many other subspecialties in pathology that are wicked cool, and I love everything. And will I still do forensics? I have no idea, but I have 2 years to figure it out. Hunter, do you want to close us out?
So, hello everyone. My name is Hunter Koster. I'm a PGY3 at Loyola. So we have a lot of Loyola representation from either past or current. I graduated from American University of the Caribbean down in St. Martin in 2023. And I'm from West Michigan. And I will be applying for forensics this upcoming cycle.
Yeah. That's so exciting. Thank you all so much. So for attendees, as you can see, we have a range of different years. We have a representation of current programs, and even, different paths of life, right? How people all came into pathology, and certainly different subspecialties that they're going into. So now to dive into the ERAS application process, which I know we're all very anxious about, as we're, for those of us who are MS4s, we're about to submit in about a month or so. So what did you guys do to make your ERAS application stand out for pathology? And anyone can take this, fair game.
I guess my best advice would be just show your interest. You don't need to have years and years of pathology activities. Honestly, I think I had one case report, but that was because I knew I wanted to do pathology. But we're the kind of field that will take all comers because if you think about every medical specialty, like renal, GI, general internal medicine, there's a pathology subspecialty that matches. So if you did a bunch of research on GI endoscopy, guess what? You could be a GI pathologist and read those biopsies. So don't think because you may have discovered the best kept secret in medicine late that you need to just like scramble and try to show that you want to be a pathologist. Um, I like to tell people that your CV is your CV. It's what you do, and your personal statement is who you are. So really let that shine through and explain why you're interested in pathology and what drew you to the field in that narrative, which you can show a part of yourself that is not in the rest of the application.
Yeah, I'll add on to that that your interest in pathology can really be expressed in a lot of different ways, whether that's through electives that you do, or if you are somebody who really likes research and you do research in pathology or not in pathology, or if you do volunteering that's tangentially related. I think that as long as you're able to express that interest in your eras, that's what's most important. The way that you do it can be up to you completely.
Oh, you.
Go, Cullen.
Okay. Um, I guess you guys all kind of like said it all. I didn't really have too much to add. I just be you, show who you are, because that's really like the biggest thing is like when you're reading these applications, it's like who is this person and like would they mesh well with the program that you're going into? Um, any research is research, if you have it, put it out there. It's like don't try to hide it if it's not in pathology. I know some specialties might think that, but pathology is not like that. Like Lauren said, anything can be relevant to pathology. We have to know both the clinical, the surgical, and the pathology, pathophysiology lab. So like, anything's fair game. Just highlight your strengths. Like, if you're really passionate about something, put it out there and like show that you are passionate about that. That's the most important thing.
I was going to say the same thing. I have nothing to really add besides whatever they just said, because they summed it up really well. Own yourself, be yourself, call it a day.
Awesome. So with that, can you guys talk about what experiences you personally highlighted, or I guess what experience did you have with pathology when applying, and maybe ways that you wove those experiences into your personal statement, the approach you took with that?
I can start with this one. So for me, being a Caribbean student, there is some challenges with that, like especially with getting rotations, depending on what school you're from, which we can talk about later on. But just having the rotations themselves, I didn't have a lick of research, to be completely honest. I was kind of working on a project with one of my surgical attendings at the time. We didn't end up finishing or anything, so we didn't really get to much to even talk about that. So I didn't even include that in my application. So there was like no research. I didn't do a single poster. So like not suggesting to not do that. But like just as like for those who don't have anything at this point, like don't like think, oh, I'm not going to get any interviews because I didn't have research. There's still plenty of ways to show yourself with that through other things. So I was able to get 2 rotations in pathology. My background in forensics, I got my bachelor's in forensics, was able to tie that in. Um, and then just with my passion for pathology alone, and I was able to like exude my passion for that through my application as well. So just all comes back to kind of being yourself and how you phrase it, and like just showing an understanding of pathology. That alone, it's going to go miles during the interview process. Just understanding what pathology is, or even AP versus CP, because you'd be surprised.
So I did a bit of a left shift or a right turn with my personal statement. I wrote about my love of baking and compared it to how my skills as a baker, with being precise and visually accurate, kind of reflect pathology. It was a little tongue in cheek, just because I wanted to show something that was important to me as well. Um, for the rest of my personal statement was really focused on my goals. I have a bachelor's in health law, and I am really interested in quality, medical affairs, regulatory science, all that fun stuff. And so that's what I talked about, and then how I would bring that experience to the laboratory. So it was my unicorn moment, I like to say.
I like that. That's so unique. That's cool. Yeah, I mean, because you can go so many different ways with it. I know that Dr. Mirza does like a really good like personal statement thing. If you haven't seen it, it's out there on social media somewhere. But it's really about like finding out who you are. I think I had drafted a personal statement and thrown it away like probably 25 times. I ended up kind of going the route of, showing, I guess because I had taken some time off between undergrad and medical school to do microbiology and then showing kind of how I ended up where I am, and how that is like a unique experience is kind of how I went. I guess I took a little bit more of like a timeline approach, and then ended up with a little bit more about like how Lauren said about like goals and stuff because I had done like a master's in bioethics, and so not everyone does that. So it was kind of like why for pathology. So I kind of like shared a little bit about that at the end. But yeah, it's like, showing who you are and your story. It's the most important.
Yeah, I agree with what everybody said. I mean, the personal statement is supposed to be personal, right? And it's supposed to kind of express who you are and why pathology at the same time. So I similar to the others, kind of expressing what I love about pathology and why I wanted to do it. I talked about my love of stories and storytelling and how pathologists in in a way, the practice of pathology is a practice of storytelling because you're interpreting tissues and data and laboratory science into the clinical story of the patient. And so I think just kind of piecing together all of your experiences in pathology and what really you like about pathology, um, and formulating that into coherent sentences, is just the way to go for your personal statement to really show who you are because you want to show the people reviewing your application why you are a great candidate and why you love pathology, other than it's awesome.
Think somehow you just remind me of Nisa. I don't know how it dinged in my brain, but just as a reminder, like obviously make sure other people read it and other people like review it in order to like edit it, but also make sure that even with the amount of edits that you do for with other people, you don't lose yourself in that process. The point of it is to make sure you're talking about your own perspective and your own experiences. Obviously, still get feedback from others. That's still an amazing resource to have other people read your personal statement, but in the end, it's still your personal statement. That's definitely something to keep like be more mindful of as well throughout the process.
Yeah,
Don't use AI.
that's
Sorry.
what Cullen just put in the chat actually. And our fourth year clerkship director, Dr. Ozark, some of you might know, actually mentioned in a recent session that personal statement is not the way to use AI. You can try and use it for experiences and framing those into the 300 or 750 characters. But personal statement, you definitely won't capture kind of what all of you were mentioning, which is like the essence of like who you are, because you really do want that to come through. So I appreciate you all sharing that. So I know that there's some possibility to tailor personal statements to different programs or different types of programs. Did you all end up doing that? How did you approach that? Were there some programs that you decided that you would tailor it to, and others you said general statements to? What was kind of the approach for all of that?
I did all of that. So I kept probably 80 to 90% of my personal statement the same.
Mm-hmm.
And then in the last paragraph for like my top 5 programs that I was looking for, I would tailor it to why I specifically was looking at that program. So I remember Michigan distinctly because we have a division of quality and healthcare improvement within the Department of Pathology, and that to me is really cool. And so I talked about that at the end of my personal statement. But other than like a few programs, I just had more of a general closing and sent it to the rest because it took way too much time to try to dig into the rest, especially the programs towards like the bottom of my list where I'm like, I'm applying, but I really hope I don't go to where you are.
I did a similar thing, but caveat, like we didn't have the signaling back when we were applying. So like my way of signaling was like my top three programs. I had like put in there like the reasons why I was interested, kind of like what Lauren said. But I don't know if that's necessarily as like helpful anymore now that we have signaling. Maybe it could be a little bit of a bonus. If you know, but I will say it does get kind of tricky. You really have to make sure you label all the documents correctly and check them because it gets hard to keep track of like where things are getting attached in ERAS. So that's my experience there.
With that, just to kind of piggyback off of what both of them said, if you do decide to write separate letters, kind of what Cullen was hinting towards, make sure you double check and even triple check to make sure you're sending the right information to the right program. The last thing you want to do is like accidentally send the personal statement for like the Midwest region to like someone in California. Like that's it's not going to go well. So just kind of be extra cautious when you're doing that. Maybe make like a separate document of like, okay, these are the documents I want to this place and so on and so forth. That really help make sure you organize it to make sure programs get the information that you want them to get.
Lisa, just wondering if you had anything else to add.
I did not send like specific personal statements or anything to different programs. I had one personal statement that I sent to everybody, and that was a struggle to put together for me because I think I went through multiple drafts of it where I was like, oh no, I hate this, and it started all over. So kudos to you guys for making multiple because that sounds like a lot.
Although we do have the advantage of signaling, Cullen, Lauren didn't have that advantage, so worked out for us. So I know I see some, questions in the chat that hopefully we'll address with this next question, which is how did you guys decide on which programs to apply to? How many did you decide to apply to? And how did you come to that number? What was the algorithm for making those decisions?
I can start first with this one. So being a Caribbean student, it's kind of fear-mongered into your brain that you have to apply to every single program out there. Your school might even tell you you need to dual apply and apply to family or IM or some other secondary application. If you have a strong application, do not listen to your school. Point blank. They don't understand pathology. All of the counselors are only centered towards the primary care clinical rotations. Yes, they have some knowledge, but for the most part, depending on the school, they know nothing about pathology. They're just trying to make sure you match somewhere, which is still important. So take that with a grain of salt. But overall, when I applied, I just geographically, I wasn't too interested in the Northeast or out West. So I kind of kept mine more centered in the Midwest to be closer to family. Overall, I applied to 90 programs, got interview invites for 17, sat for 15, and ranked 13. Just as like a number wise thing. And then I just went based off of location and where I would be willing to move to and called it a day. Being a Caribbean student, I made sure to rule out all programs who either don't have a single Caribbean student or IMG in their class throughout all 4 years, or I even created a Excel sheet of like the top 4 Caribbean schools and went through their previous rank list of the past 4 years and ranked and wrote down for each school where all of their people went to show odds of where possibly I would have a chance at, which could be excessive for others, but I want to make sure I wasn't wasting time applying to places that I know they're just going to throw me away because of being USIMG.
As a certified anxious girly myself, I heard different things about how many places to apply to, and hearing, USMD, oh, you can apply to 15 places and you're fine. And I was like, surely I need more than just 15. But again, anxious girly. So I applied to 35 places. Something to keep in mind is that your first 30 applications are what, $10 per application, something like that. I don't remember.
That
And
sounds
then
right, like
beyond,
11 maybe or something.
yeah,
Yeah.
11. And then after those first 30, it goes up. I think it doubles in an amount. So whatever you're financially comfortable with, keep that in mind. For me, I thought a lot about location. Being close to family was really important to me. So regions where I had family and friends to support me during residency, that was kind of like my most important thing to consider. And then I kind of just went from there, looking at regions in the Midwest and Texas on the East Coast, and kind of just whittled my list away down from there.
Yeah, I think it's going to be obviously like different for everyone in terms of like, how you feel like your application is and like everything. And like we talked about before, depending on your circumstances, financial, medical school, all of that stuff. I remember I mean, I don't know if either Nisa or Rasa had a different experience, but I remember when I was applying, our dean told me a lot more applications than I ended up doing. I think he told me to do like 30 or something. And I was like, I can't even think of 30 programs that I like want to go to be honest. Um, but I think I ended up doing 15 and I interviewed at 14, I think. And I ranked them all. There wasn't anything that I didn't like at any of the programs, so I didn't end up like not ranking anyone. But yeah, it's going to be different for everyone.
Yeah, and I would just to add on top of that, like think of things that may not necessarily be part of your job. Um, so for my goals, I very well may end up in industry. So I would do better with having a recognizable name behind my residency program. So I tended to stray towards the top end of Doximity. But then I was married and had one kid when I was going through the process, and my husband had very few asks, but he's like, can we not live in California? And can we not live in the middle of nowhere? And I'm like, you know what? I can work with that. Being Midwesterner, I wanted to be more towards the Midwest. And then some advice that I got is if you have a direction of where you think your life is going to go. So for me, being involved in like professional societies, leadership roles, I looked at the past presidents of USCAP and see where they are. Michigan has five. So that told me pretty well, okay, then this program really supports residents who are in these activities. Or look at the resident forum for the CAP or the resident council for ASCP, see where those residents are. So you can find places that reflect what you value, but you need to know what you value first. I applied to 20 because was like the median at the time. When I went through, I got interviews at all 20. I sat for 13 interviews and only ranked 12 programs. So it really is a personal thing. And yeah, I get advice from people, but also just due to your comfort level. My husband always tells me, he's like, you applied to too many. And I was like, I was not going to go under 2 digits.
Yeah,
Yeah.
I think it's becoming very popular now to do a lot more geography based, based on like who you're living with and who you're like where your family is and everything. And I think that's great. I think, back in the day, people would be like only apply to like the top programs and all of that thing. I think that's kind of changed. Advice that I got early on in my career was like the resident makes the pathologist, not the program. So if you're a really driven resident, if you're a really driven person, you're going to be a great pathologist no matter where you go. All the programs will train you. You'll get board certified. You'll be good. Some programs will fit better than others, and that's probably where the disconnect comes between people like loving where they are or not. But if you're driven and you're excited about pathology, you're passionate, you're going to be a great pathologist. So just putting that out there because there's programs for everyone out there, you know.
One thing I looked for also is if you already have an idea of what you want for fellowship, or if you have no idea what you want for fellowship, but you're tired of moving, make sure to move to a location where one, they have that fellowship of interest, or two, it's in like a city like Chicago where you throw a rock and it's a medical institution where they have like so many fellowships. So that's something to kind of take into consideration as well if you just want to be more secured and not really have to worry about moving too far type of thing for down the future.
Yeah, all of that is super great advice. You guys are sharing massive pearls of wisdom here, and looking at which programs to apply to and select. I wanted to address a couple of questions that I received in the chat. Hopefully, you guys can shed some insight. So, it's kind of a two-part question. And so, this individual asks, um, they're taking step two at the end of August, and is not having a step two score mean that they won't get interviewed. I do know that personally, my step two score came out very quickly within a couple of weeks of me taking it. So I don't know if that in a way answers your question, but in the event that this person doesn't receive their step two score, do you guys think that that impacts their chances of getting interviewed?
Can go or at least attempt this one and see if anyone else has any other thoughts. So with me, I was in a very similar boat where I didn't finish cores until July 15th without work with my clinical rotations. So I was studying for step two while also doing my away pathology rotation, and I had to take it August 26th. So it was very close to the cutoff date. I did receive my scores within time because normally it is around like 2 weeks. They say expect a little bit longer, but still like that two, like the second Wednesday away from the day that you took the test where I still get the test scores. And I believe, don't quote me fully and quote me on this one, but I do feel like I've heard like program directors say before, like with information like that, usually it is more readily updated, like when they pull your profile. But if you are worried that they don't receive it, you can always email the programs you apply to. It's like, hey, just as a heads up, my step two is in and it should be updated accordingly into my ERAS if in case they need like re-download it or whatever they have to do on their end in order to make sure they see the score.
Yeah, I took mine at the end of August as well. I think I took it after my away rotation and it came in time. I think just barely in time, but it did come in time. It comes quicker than you think. And I again, we were with step one scores, so I think step two mattered less. I think step two matters a little bit more now. So maybe at some of like the, top 10 programs, top 20 programs, they might care about it. In those cases, like Hunter said, you can always send an update. Now that we have that universal release date in the middle of October, you might actually be able to, like, if they were just like, we're not going to look at you until you have your score, then they might have some time to look at you after that. Because they have that universal release date, which we also didn't have. Lots have changed.
Yeah, I applied without step two. I took it after I applied, but I also had a numerical step one because we're old.
I feel that. Um, and on that same note, the individual was asking, just obviously not knowing their score yet. I don't know if you guys have heard anecdotally regarding boards failures and like how that kind of bodes for applying to pathology. If there's any individuals that that maybe have failed like step one or step two, and whether that like automatically disqualifies them from being interviewed or even looked at.
I have anecdotal experience with someone else who went through this. Um, I've heard that it's if you have any sort of like quote unquote red flag with your application, like you failed a board or something, that it's something you could address in your personal statement and you can frame it as what you learned from that experience and how you overcome hardships and the setbacks and things like that. Um, from my general knowledge, it doesn't make you like a piranha or anything. Like people will still look at your application, and as long as you can address it in a professional manner, I don't think anyone's really going to hold it against you. Like we're all humans, and like residents crash and burn too. Like it's a job and it's hard. So don't be afraid to be a person. You're not just a robot applying for a robot job.
Yeah, honestly, I think the main thing that residencies are concerned about is like, will this person at this program pass boards if we train them in the way that we're used to training people? And so obviously, a board failure or something like that, they might have to like look into that a little bit more. They might ask you, but I think generally most places are doing holistic review nowadays. So they try to kind of look at everything that the person has. Like, let's say you didn't pass step one, but then you got all honors on your clinical. I mean, like then that's a different thing, you know. So having those pieces of data throughout your application are helpful. I think that I forgot where I was going with that, but either way, I don't think it's a like you're not going to get interviewed anywhere. But like Lauren said, there could be ways to either address it or even like ask around or something. But yeah, I don't think it's 100% no.
Yeah. In the similar vein, someone also just put in the chat about having step three before applying. I'm not sure if that exactly is what they meant. My understanding is that you don't need to. You can take that during your first year. But I don't know if you guys have heard otherwise from other programs.
I just know from experience about non-US IMGs, you can take it after you finish, and that can be helpful for programs. They can know that you're like completely done. They don't have to worry about you passing step three. So for some programs, that can be, something. Uh, I guess if you've taken a gap year, then maybe you could take step three because you would have graduated, but you have to graduate before sitting for step three.
Similar to what Cullen just said, a lot of my friends who end up off track in the Caribbean school, like they do have a lot more time, or sometimes we finish a lot early. There's a possibility that if we get all of our paperwork in together, that we could technically potentially take step three. They don't expect you to have step three done beforehand. Like he alluded to, it's usually more so for non-US IMGs who have already been practicing in their home countries and kind of already have it done, or had like a longer delay since they've been graduated that they've been applying for, where it's not expected, but it definitely will help in your application. Like, okay, yes, they're like fully wanting to come over and like work as a resident in our country.
Yeah, I think that probably answers that question. Thank you so much, Hunter, especially providing that perspective as a USIMG. Um, Great. So if anyone has any questions at this point in the general audience, feel free to continue typing in the chat, or I'll give you a minute to speak up. Um,
There was one question that popped in a while ago,
hmm,
and it said, how do you find the program that you love? What things do you look for to find the right fit? Kind of like how we were alluding to with selecting the programs you apply for. Uh, it's how you feel during the interview, and trust your gut. You can get a feel for the program really well, even on Zoom, which sounds crazy, but it works. Like there are definitely interviews where I left being like, yeah, I could be happy here. And there were definitely interviews being like, I do not want to work here. My best advice is to take notes immediately after the interview. And I had like a Google form that I made for myself with standard questions. I answered the same question about every single program with my thoughts, because once like February comes and you're like, wait, what was that program? All of them will blend together and you won't know which one is what. So having a record of real-time thoughts and reactions to each program is very helpful.
I totally agree. I had like a whole note-taking sheet. I think it's out there somewhere, maybe on Match to Path or something, maybe on one of their blogs, but I had this whole scoring sheet. I like had notes on every single thing. I tried to be super analytical. I think I've told this story before where I had like a scoring system of how everything was. And at the end, basically everything ended up being about the same score. So as much as I tried to be analytical, it was like what some place was really good in, another place was like not as good in, and it kind of evened out. The thing that I ended up going by was my final score, which was the vibe score, which I called it, which really is what Lauren said. It's like you'll get a feeling for it. Like you have that session with residents, you'll just have like banter, and you're going back and forth. You're like, this is great. Like I really like these people. Or like when you're interacting with the attendings, you're like, okay, yeah, this is cool. Like I feel this. This is a good setup, and you'll notice and listen to that intuition. And also, think about the other things like Hunter said before, like the fellowships, location, all of that stuff, because that's important too.
kind of like similar to like a net, like using the analogy of like a blind date. Like during the interview, do you wish like a friend would call you with like a fake emergency to get you out of the emergency, like to get out of the date, or do you want to like, oh hey, I actually like this, like let's go somewhere else type of thing. So fun analogy, but
I love
yeah.
that analogy. That's so great. Wonderful. Okay, so a few more questions came in. So can you talk about doing away rotations? How many did you do, if any? Thanks.
It was COVID, so I did none, but I also had a home program rotation that I was able to do.
So I technically did two, but only one before my application. And with the timeline that my school had, it didn't show up on my transcript, so it looked like I did none. One program did call me out on that. It's like, well, have you done anything experience? I'm like, based on this, like, there's nothing on your application about pathology. It's like, technically there is, but it's just not on there because it was like past the deadline by a week. Um, so they're so important. I know it's difficult, especially for US IMGs and non-US IMGs to find rotations because of VSLO. It has like a lot of hospitals have cracked down on like outside rotations who don't participate through VSLO, which is through their school, well, technically through AMA, I believe. So if your school doesn't participate through that, you are unable to go through VSLO. It is very difficult because of that, but you can always reach out to places that, hey, is there a way to rotate through here, like outside of VSLO, get all the paperwork ready months in advance, if not 6 months, if not more, to make sure, because sometimes it's a lot of paperwork to go through in order to organize that at the hospital you are at for your main clinic rotations does not have a pathology rotation.
I just did one away, but I also did two different pathology electives at my home institution and also a research elective in the pathology department at my home institution. So, yeah, but just one away. The aways aren't necessary. I'd say if there's a program that you want to see that could be helpful, or if you're really interested in a program, but otherwise, I mean, I don't think aways are a hard and fast requirement that you need to do for pathology.
Yeah, I did one away. I very similar to Nisa. I think I might have done the exact same thing, maybe like two with a research in pathology. Um, my away was not on my application, but in a way that was kind of helpful because it was at UCLA. And then I also applied like kind of broadly to the South. So we didn't have geographic preferencing back in my day. But in that way, like the people in the South didn't feel like I was like completely excluding them and like forgetting about, being over there. Because, I have family in like Georgia and everything. So I wanted to make sure I still was able to apply there. But yeah, so it being on my application was actually kind of helpful because they didn't know that. But I did have in-house rotations as well. I'll also just say from like the UCLA perspective, and I think from Stanford as well, like if you do aways at places, like, if we see people here that we really like that is something that is very helpful for the people applying. So it probably happens elsewhere too. But if you like really rock your away rotation and everyone loves you, then that can be really helpful. So obviously it's super expensive. I remember not being financially very comfortable at all staying in California for a month. That was very expensive. Yeah, but it ended up helping. I don't know. So yeah, it's a lot to consider.
Yeah, I think the financial aspect can be like understated. We are fortunate in pathology that it's not a hard requirement. Some specialties have that hard requirement of having to do aways. So probably more of a consideration for yourself and whether you can afford things or maybe you have family that you can stay to kind of offset costs, which makes sense. Um, Another question, how big were your residency programs and did you like the size of your cohort? So do you feel like size of the program and like your particular class is a factor, a deciding factor in your choices?
I don't think it was something I really thought about when I was going through. I did look at the size of like the faculty and the split of like research only versus clinical on the programs I was like really interested in. We have 28 residents and like 30 fellows. My department's gigantic. I kind of like it because like there's always someone around that you can just bounce ideas off of, and we get a little crazy on Fridays because we have a big open resident room. But some people wanted a really like intimate small class where they have more one-on-one experiences with a smaller faculty group. So it really just depends on personal preference.
I was really torn on the actual size thing because coming from Loyola, it was a little bit of like a smaller program, and I really liked how tight-knit everyone was. I was like, the resident room is fun. I know all the attendings. This is a great place. Like I felt very at home and I felt very comfortable there. Um, and then I was also kind of considering like, how much surgical volume or like whatever. So I kept going back and forth, and I was like, if I'm at a really high volume place where I have more residents, like, will I be overwhelmed and not have enough time to learn? And I'm still struggling with that. Still trying to figure out exactly what the balance is. I don't think there is a good balance. It's just the programs work how they work. I think we're 26 now, so it's a little bit on the bigger side. It's not, the 50 plus like the people in Boston, but it's still a good size. I really like having, everyone around. You can't really predict your class. It just becomes whoever you match with. So you end up becoming friends with them, but it's something that's kind of unpredictable. But you'll kind of see who applies to the program when you interview, because you'll do like some like group stuff usually, and you'll be like, oh, these people are really cool. Like I really like the people that are interviewing here, and it's probably about the same for all the interviews. So yeah, just some considerations there.
One of my best friends and I interviewed together for a different program, and we both ended up at Michigan. So you meet people on the trail and they don't go away. Path is a small community and it's wonderful.
All right, another question. So if my whole CV is focused on microbiology, residency in my home country as an IMG, should I write about my passion for micro in my personal statement, or should I write it more towards APCP? I'll apply to APCP programs because there aren't many CP only programs.
Kind of put something in the comment, but I'll kind of reiterate this just so it's also recorded. So for a personal statement, write whatever you're passionate about. Don't like write about something in expectations that they're going to ask you about it. That's what the interview's for. They want to show what you're like they want to know the passion. They want to know who you are. They don't want to know like what they expect to ask you. So just follow that more so. You can apply for APCP and CP only programs, and then only the programs you interview at will know what you're applying for. So you can also play that game just as much as they play their game. So just kind of keep that in mind, but I wouldn't like apply APCP and CP only at the same program, because then they might kind of ask more about that unless you are I actually don't know how to phrase this in a way. Like, I don't know if that would look bad, but you may have to like kind of be more careful if you do that, or they may ask you like, which one do you actually want more, to see how they would rank you in that respect. So, yeah.
I think that's a great answer to that question. Um, so as far as, the programs that you guys apply to, maybe you can comment, is there a specific number of letters of rec from pathologists that most places look for? Just around 2 or 3, kind of, are there expectations?
Minimum 1 from a pathologist. That's really like the minimum that you absolutely need. Someone who can speak to on your behalf. And beyond that, if you have more from pathologists, that's great. I think I wrote this in the chat as well, but also so that it's recorded. You can look at the specifics of each program that you're interested in, and their websites will usually have a breakdown of what they want in your application package, how many letters. Some places are really serious about not wanting more than 3 letters. Some places are really serious about wanting 1 pathologist, 1 non-pathologist. It's like a clinical letter, a non-pathologist clinical letter, or a research advisor or something like that. Just look at the specifics from the programs that you're interested in. They'll usually tell you what they want to see and don't send more than they ask for.
Yeah, totally. I think I even thought about, I was like, oh, should I get like another one? And like everyone was like, no, three. So I was like, okay, we're doing three. And I got like the one from a pathologist, one from family medicine. I think I did one from a chair. Some places required it, some places didn't, or some places recommended it. So yeah, just look at the requirements like Nisa said.
I ended up doing four. My fourth was a chair letter, but my medical school pathology chair was kind of a bigwig in the community, so having his name behind me worked well, but it certainly wasn't necessary. No one mentioned my letters in my interviews whatsoever. No one cared.
Great. What is the best way to reach out to programs before applying to show interest? Or is there a way? Should you do it?
I mean, I didn't. If you happen to be at a conference, like there's another question about attending ASCP, and you can like go to a fellowship fair or like meet people in person, that's one way to do it. But on like the admin side, like of course program directors will answer questions, but they are so overwhelmed by the emails and the applications and the coordination, the open houses and everything that like your email is more likely to get lost in the shuffle than anything else.
Yeah, yeah.
Go ahead, Cullen.
Oh no, I was just honestly gonna say probably discourage reaching out to the PD until after an interview, just because of that. And if there's an open house, for sure, go to those open houses, and then if you're going to meetings, like see if someone's presenting a poster from that program you're interested in, and just get to know them, like introduce yourself. Sometimes the residents are involved with the interviews or rankings, so like it could be helpful to know who they are, or just get to know what the people are like there. And yeah.
Trying to think what I was going to talk about. Oh, being a Caribbean student, I know for my like fellow colleagues, I don't know what to call them anymore. They, especially if they're competing for like anesthesia or like surgery or anything like that, some went to very extreme lengths to get interviews. Some like would legit show up to programs with donuts. Like I'm not kidding. Like they went above and beyond. I would never do that. My nerves would be through the roof. But if that's you, then by all means do that. I don't know how that would go in pathology, but it's an option. Um, I don't know if it's a good one or not, but they matched there, so it must have worked at least for that program. Um, I don't know.
Wild
Yeah,
and kind of inappropriate, frankly.
I mean, you never know. Yeah. Um, but yeah, it's an option. But like what Colin was saying, it's a great resource to go to conferences. A lot of times they're free for medical students. If you can find time and the money to like stay there and travel there, that is usually the main hurdle. But everyone's super friendly at any of the meetings. Even like I was talking to a couple of like medical students last year and like, oh yeah, they're really cool. And like, oh yeah, we applied. It's like bet. So I was like, went over to my program director. It's like, hey, they applied for us. Like, well, here, like show them to me. It's like, all right. So like they had a powwow and talked at the conference. Like you never know who you're going to meet. It's a fun time. You can definitely go, but don't stress yourself out financially or emotionally to like make sure you can attend. Only attend if you're actually able to.
Yeah, I actually met my PD. Well, he wasn't the PD at the time, but I met my PD at USCAP, and he was the medical student coordinator. And so I was like, I applied for a away rotation, and then like he ended up becoming the PD. So it was good to see people again, not required, but it's always nice to like network if you can. It's I don't know, pathology's awesome. So the community is great. You can always get to know people no matter where you go.
Along that same vein, just be nice to everyone you meet everywhere at any time. If you're at a conference, if you're on an away, if you meet someone on the street with a pathology hoodie on, like just be nice to everyone, be polite, don't be weird. Try not to be weird. Everybody's weird in some way, but curb it a little bit. Um, and then as for reaching out to programs, I would shy away from that unless you have a very specific question about the application process for their program, or if you want clarification about letters or something, maybe reach out to the program coordinator. I would not reach out to the PD. directly. There's usually an email address for the program coordinator that would be someone to potentially ask questions to. Um, or if you know happen to meet residents or someone else and attending from that program out and about, then feel free to ask, but don't bother people.
The only caveat I will add to that, as someone who is looking at physician scientist training programs, some programs do indicate on their website that you should reach out to said person once you submit your application, just so they can like flag it for their specific needs. So unless a website says so, I think, probably defer to the wisdom of these fine residents that you shouldn't be reaching out. And a follow-up question I had actually when you guys were talking is regarding post-interview. What is the etiquette for that? Are you following up, sending thank you notes? What are you doing? Bringing donuts? I don't know.
Don't bring donuts. Oh my God, please don't do that. Some programs will be very specific in as to what they want and what they're okay with. Northwestern, for example, at least the previous PD said they would be not doing any post-interview communications, and that was not a lie or a haha, like you can send us anything. No, they were very serious about once we interview you and you've had your day here, we're not going to contact you again. So I think it's program dependent. Definitely during interview day, people might say something towards the end of your interview day as to whether they want or are okay with post interview day communications. Um, Thank you notes or emails or whatever, completely optional. I think again, some programs will say, sure, if you want to send them, send them. Other programs will say, keep them. We don't want them. So it's really just program dependent, I think. I'm an anxious Annie and I sent thank you notes, but that's just who I am as a person, I guess.
Were they handwritten, Nisa?
Oh my God, no, that's too
Yeah,
much. They were emails. No, I did not handwrite in cursive and include flowers in the envelope and like sprayed my perfume. That's psychotic. I did not do that. Emails, very short, 2 sentences. Thank you for your time. I enjoyed it. That's it.
I didn't send any thank yous. I only reached out when I had very specific questions. So like I thought I was going to go into molecular potentially. And so after my Michigan interview, I like asked about molecular because I didn't get to talk to a molecular pathologist. Or in a couple other programs, I had like very specific things that I wanted to know about, but it gets very overwhelming and very tiring very quickly. And I realize I'm saying very, but I'm trying to emphasize that. Like you get so burned out that I couldn't even fathom writing more emails unless there was something I really, really, really needed to know about like my top 3 programs.
Same thing for that. I know I didn't do any thank yous. I didn't send emails. Only thing I did was a letter of intent to my top choice, and that's it. Um, One program did offer second looks that I interviewed at, which I thought was cool. Like if you had like any last minute questions or just to see them again or just wanted to jump on, they did like a separate meeting specifically for like a second look if you wanted to. One program let me actually go there and actually like tour them and like talk to them like in person and like kind of get a feel for the area because I was super interested in them. Which some programs might let you, other ones most likely will shut you down. But I tried and they said sure. So like, all right, road trip. So if you're super into the program, you can always ask. They're not going to like penalize you for asking. The worst case scenario is they're just going to say no. Just obviously maintain professionalism and respect. Just go from there.
Yeah,
Okay.
I think I had had a couple places like offer things kind of like Hunter was mentioning, like they'd be like, "Hey, we have this optional thing if you want to come." Like, there were different things, and like one of them I had heard from someone that the sign out sessions were like really intense, so they offered to like have me shadow a sign out session, and I was like, that was actually kind of helpful because I got to know a little bit more about how attendings and residents interact. Um, and yeah, in terms of like emails, I didn't send thank yous unless there was like a really good conversation that I had had with someone. Um, and the yeah, and then I think post interview I really only sent my letter of intent. but I don't think anyone like expects you to be following up because there are strict rules on like what you can say and can't say.
Great. Thanks, guys. So going through these questions, it's so exciting to see it. People asking so many questions, so curious about your path. I know Lauren and Hunter answered this question in the chat, but again, for the recording and maybe Cullen and Nisa, you guys can jump in. What are the research requirements or expectations for residents at your specific programs?
Sorry, what was the question? I was reading the things. I missed it.
No problem. So what are the research requirements or expectations for residents at your programs?
We don't have strict requirements. I think we have like the recommendation that you know, do. The one caveat, I guess, is the QI requirement that's required by ACGME. So like we have to do some kind of quality improvement, which kind of is research, and usually someone ends up either doing a poster or something. You know,
Rude.
but you know, if you do something like, oh, this process is really great, and you share it, that's cool. It kind of counts as, you know, a way of sharing the research. I like quality too, so I'm a fan of it, but I know that some people don't like doing it. So if they can make it a research project, they do. But yeah, we don't have requirements.
Same here. It's encouraged and supported, but other than the QI project, it's really up to you to be as involved as you want to be.
Usually in pathology, there's too many opportunities for research, and you have to start turning them down. That's the problem.
If you can't find any,
So
you're definitely
true.
doing something wrong.
Great. And then Hunter and Lauren, do you guys just want to say for the video recording what kind of you put in the chat for your programs?
Yeah, so we're encouraged, but not required. And we can choose pretty much whatever topic type we want. My projects have ranged across specialties and across specialties and types. I've gone to ASCP on a case report for 4 years in a row. Hot tip. And we get funding if we have a poster at a conference as well. So that can be a really good way to go to like a specific society event or someplace you want to go. But yeah, like Hunter said, if you don't have things falling into your lap, like at least once a week, I think either someone doesn't want to work with you or you aren't paying attention.
Very true. For me, it's similar. The only advice I would say is make sure if you already know what fellowship you want, gear what projects you do near that fellowship, because that's a very quick way to get burnt out. I was kind of all over the place on what I was interested in, so I did a lot of posters, a lot of possible papers and projects and QA projects across a very broad horizon, and I got very burnt out. So be very conscious of that and your own mental health when it comes to projects, even in med school as well, just in your life, basically. So be conscious of that, be more careful what you do, but kind of start thinking about fellowship. Also, just do something you're interested in. If it sounds super cool and it's fun intending, then sure, do it. But also, like, kind of be conscious of how much time that will most likely take as well.
And as a resident, you're usually expected to actually finish the project versus as a medical student where you're not always expected to finish it because you're there for 3 to 4 years. So they'll probably be like, hey, did you look at that? And then you'll sign out with them a few weeks later and they're like, hey, did you look at that project? So, you know, definitely be aware of what you say yes to.
They will find you. It's like Liam Neeson and Taken.
All right, guys. So moving right along, just because I don't want to keep you all here. I know everyone's super busy. So to get a feel for a case volume, is this something that you can ask about in interviews, or how do you go about figuring it out? And I guess putting it in a broader question, is there information that you certainly should know or want to know before you rank your programs, but that is maybe like off topic to like ask during interviews and you should just research on your own?
I guess the big things that I wanted to know about every program is what their cycle was. So you generally there's like a 1 day cycle or like a 3 day cycle, which is like we sign out gross and preview every day when we're on a sign out service, and that's a 1 day cycle. You can ask the residents for sure about their volume and what their day on service looks like. Busier programs will have case caps and can kind of graduate the responsibility for the number of cases that you will do based on your experience level. And just in general, like a lot of like the workflow, like do your attendings bug you after sign out? Like how much admin work, which generally it's not that bad. Um, but you like most of the residents are going to be super candid because we want you guys to know what you're going to get yourself into if you're coming to our program. So don't be afraid to ask. Probably don't ask the attendings because they have no idea what the residents do for the most part. We just show up with what they need.
Yeah, I think I had most places will tell you what their general surgical path volume is. There are probably like some places that won't just generally advertise it, but you could always ask like in an email, like the coordinator could probably tell you. I mean, our coordinator probably doesn't know, but she would find out and just email you. But like I put that all on my things. I didn't really know what that meant initially. And now that I'm actually in a program that's very high volume, I value that. I really like the high volume, but there are certain people that don't thrive in that scenario. So I think that you kind of look at how you learn, look at how you work. If you get distracted really easily, if you kind of like get overwhelmed really easily, maybe like a higher volume place won't be as good, but like a really well structured, like medium volume residency would be good. There are generally, I think, like minimums, but that's like required by ACGME. So it's like, they won't offer a residency if it's like below a certain surgical path volume, for the residents that they have. But, generally you're looking at like that kind of medium volume or high volume scenario, and then thinking about how you can like work in those situations. And like Lauren said, we'll tell you like it is. I'll tell you right up front if it's overwhelming or not. And the residents are going to be honest. Attendings won't know. And then the cycle is important because a high volume place that does a 2 day cycle or a high volume place that does a 1 day cycle, they're different beasts.
Yeah, I think those are all really important things to consider. So I was scrolling through the questions as you guys were chatting. It looks like, some maybe uh, individual specific questions were answered, especially thank you, Hunter, as our IMG, answering the IMG questions. A couple questions that I did want to address for the video recording and for everyone in the audience were kind of what is a typical interview day like? How long does it last? What is the commitment, I guess, that you have for that day? Do you have breaks in between? What does that look like?
That's another, every program is different. In my experience, most had us interview with like 3 attendings and plus a PD or an APD. And some had you talk with residents either one-on-one or in a group setting or both. A lot of places had you tune into their like morning conference session so you could kind of see how the teaching was kind of goes at their program. Words are hard. It's 9:05 p.m. my time. I definitely did have breaks. Some were better about giving breaks at normal times than others, but you made it work. Generally, they were like half to like 3/4 days, and some programs have events the night before as like more of a social meet the residents. Um, Path is very chill. No one is going to be like mad at you if you are like, I'm sorry, I had to go to the restroom. It's okay. And they try to respect your time as much as possible because everyone gets tired.
I think that's great. Thanks for that insight, Lauren. Just to not keep you guys here, I think we'll kind of, it seems like everyone's in agreement with Lauren's answer. And then I also did want to read her response, which, Hunter, Nisa, and Cullen, you guys can jump in if you disagree, but someone had asked about just like what pathology, a day in the life of a pathologist essentially looks like, of a pathology resident. And so Lauren had answered that every program is different. Understandably, she works 8 hours on CP rotations and 12-ish hours when she's on AP. Call is variable, taken 3 times a month at her program. And then she works 2 weekends with every AP rotation and not on CP. I know there's some programs that do not at all work weekends. The timing is variable. I think that depends a lot on the case volume of each program and depending on what service you rotate through. I don't know if you guys have anything else tidbit to add before we wrap up with our last question.
For that, I just want to say that when it comes to like that scenario, that is usually a very hot topic when it comes to interviews themselves. They're not trying to like sugarcoat or like hide anything from you. They usually like depict a typical day of the resident. In most interviews, either by the residents or the attendings themselves, it's a very common question. So you'll be able to get the best fit of what would work best for you during that scenario, during those interviews of like what they say for their perfect day, either on AP or CP, along with the call frequency as well.
Yeah, and that also goes along with, how big the program is, how many days they have to cover. Weekends are usually a very hot topic for interviews. People are like, do you work weekends? The only caveat is that you don't want to sound like you're trying to not work weekends because, I mean, the hospital's open 24/7, 365. So as much as pathology is very nice and we can usually work like 9 to 5-ish. Stuff has to be done on the weekends sometimes. We are not assigned stuff on the weekends, but I come in almost every weekend when I'm on Surge Path, just because I feel like, it's helpful. But just a caveat when you're asking the question, be very tactful so it doesn't sound like you're trying to get out of work.
Yeah, for sure. All right, guys. One last question. Thank you so much for all the advice you've already shared. Thank you all for participating, in the chat. So many great questions. Sorry if we couldn't answer all of them. I just want to be mindful of time. So one piece of advice for those in the audience currently applying to pathology that you can give. Something very easy, wrapped in a bow. Take this away from this session.
Congratulations. Welcome to the best field ever. You made it through like the hardest part, which is medical school, and you're on to much better times in pathology. Like Nisa said, be nice to everyone. It's a small community. This is a great time. I'm really excited for all of you. Really enjoy the time that you get with all of these people in all the interviews because you'll see them forever.
And as
I'll
much as
go a
I
little
joked
more.
earlier
Go ahead.
about, oh, sorry, as much as I joked earlier about not being weird, you do want to be yourself and find a program that you're going to vibe with, and the people at that program are going to vibe with you because residency is a long time. Even if it's 3 years, you're doing AP or CP only, or 4 years, you might stay there for fellowship, who knows? But you want to find a program that you will mesh with. So do be yourself, do ask questions about what's important to you and what you value in your education and in your life, because time is going to keep going. You're going to keep getting older. And if there are life goals that you have for yourself, like starting a family or whatever, or traveling or whatever, you want to make sure that your residency program is also going to support that. So be true to yourself, figure out what you want out of your life and your education, and find a program that most aligns with that.
You'll spend more time with your co-residents than anyone else, so don't go to a place where you don't mesh if you can avoid it. And also don't pick a program because of like a certain pathologist or like a certain named researcher. People move all the time. So you're not going to do yourself any favors by going to X program because pathologist A and B work there.
Kind of similar stuff to what the past three just said. The interview process, it's a very long time. It's a very stressful time. Overall, they need you just as much as you need them. So in summary, just have fun with it. Like they said, be yourself. Just try and have the most fun as possible throughout the process. I know it's a very nervous and anxiety inducing time frame, but in the end, it is definitely a fun time. Like you've done a lot to get to where you are now. You're definitely worthy of getting this far and going above and beyond to get where you need to go. Just remind yourself of that during this time frame because it can be grueling sometimes. But you got this far, you're going to get even farther. So keep that chin up.
Thank you all so much. Really appreciate y'all's time. Thank you to the attendees for joining. I hope this was a useful session. Again, feel free to review it on the Virtual Path SIG website in case you forgot some things that you want to reflect back on, and check out all of our other great content as you venture through this journey into becoming a pathologist. Have a good night, everyone.
Bye, everyone.